Thank you for joining us today. We're going to be talking about migraines, and we really wanted to just share with all of you some of the new information that's come out about migraines, in particular, some of the really cool information in the natural world and how things have changed in our clinical practice for our migraine patients. I'm Dr. Molly Force, and I'm the clinical director here at Prosper Natural Health, and I'm joined with Dr. Rosalie today. We practice team care here at Prosper, which means that we work together with our patients to really provide them with a holistic approach from both a primary care perspective and this approach of natural medical model as much as possible. Now, Dr. Rosalie also, you'll see, has a degree in Ayurvedic medicine, and we try to integrate that into our medical perspective as well. And that is this an East Indian background in treatment and care. So we're doing these doc talks as a way to really help relevant information be shared with our patients and be shared with our community. Each month we're focusing on a different topic, and especially in frequently asked questions. Now, migraines and headaches are something that comes up quite a bit for us. So we wanted to take time to go over what we can be doing to support people so that they're not suffering from migraines. So things that we want to make sure we're covering today are what exactly is happening in the brain when someone is experiencing a migraine, because that helps us understand the physiology. And when we understand the physiology of what's going wrong in a health imbalance, then we can start to really treat the cause and look at the mechanisms of cause. We also want to talk about the different types of migraines, because there are so many different types we're going to cover today. And we want to talk about how there are these different types. A lot of people just think a migraine is a migraine, but that's not the case. It can show up in many different areas of the body. We're going to be, of course, covering different natural medicines that we utilize. And we want to also look at what's new in the medical research and share that science with you. So when we're thinking about migraines, we've really expanded our understanding of what's going on biochemically with migraines over the last few years. And so that's some of the most exciting data that we're going to be showing with you today. Migraines really are very impactful. They're one of the most incapacitating reasons that people will come in asking for medical help. And we see this particularly in this age group of 18 to 44 years old. We have the highest prevalence, but we also see migraines throughout many different other age groups as well. So it's not just these 18 to 44-year-olds, although that is the age group that gets most affected. So there's a difference between a headache and a migraine. So the headaches are really defined as being more short-term pain, and they don't typically have associated symptoms other places in the body. It's just pain in the head. Migraines, on the other hand, have a throbbing sensation typically that's considered to be worse than headache pain. It's typically one-sided, and it can last up to 72 hours. And they come with or without an aura. And we'll talk about that more as we progress to this talk today. But associated symptoms with migraines are everything from digestive symptoms like nausea, vomiting. We can have photophobia, which means pain with light sensation, difficulty with our sight. We can have changes in how we're perceiving sounds. We can have changes in how we're perceiving smells. We may even be having problems with our cranial autonomic symptoms. So we'll also be talking about that today. Now, as far as characteristics of migraines that make them so unique is that they can really vary from patient to patient. So it's always important for us to talk to our patients and say, well, how does your migraine present? Like, what happens for you? How do you know it's about to start? Because there's often these things called prodromes and then these subsequent symptoms that happen for people. And sometimes they follow in a very specific pattern, and other times they can vary slightly. So that's important to understand.
Thanks, Dr. Molly. So when we think about migraines, they're this just debilitating group of symptoms that can really affect every age group, from infants all the way to folks who are postmenopausal in their elderly years. And the thing with migraines is it's just still they're still kind of being figured out by science, right? And we'll go into these theories now of what they are and why they are. So around 1975 or so is when the vascular theory emerged, which means that which is just this theory about migraines that is only focused on the vasculature in the brain. So for example, there's a vasodilation of the cranial arteries and then a vasoconstriction of those. And that's what causes the migraine. And that was the prevailing theory until very recently. To quote Peter Goadsby here, he says that the vasodilation in this vascular theory is an epiphenomenon neither necessary nor sufficient for the symptoms. So what they've noticed is that when there is, for example, vasodilation in the brain, it can cause migraine symptoms, but not always. And actually what causes the migraine symptoms is the type of receptors that are bound by the inflammatory markers, or the, there's a whole cascade of things, but the receptors that get bound that cause the vasodilation are actually the key. Hence this new theory out there known as the neurovascular phase theory. And this has come out, ever since, I think even since med school for me. So this is brand new. And it talks about migraines being a phenomenon that's both nervous system and neurovascular. There are 3 phases in this new perspective. Phase 1 being the premonitory phase. Some sort of trigger will activate the sympathetic nervous system, which is our fight or flight nervous system, which then causes there to be a fight or flight data that floods the brain. Okay, and this fight or flight data, these neurotransmitters, then have a whole bunch of other things happen to them. So for example, they cause what's known as a nociceptive signal cascade, which just means, okay, the pain signals are activated. So these are all just kind of fancy terms. That means fight or flight system activated, then we get some pain signaling happening. The rhythmic brainstem activity is really important here because this tells us about how well the brain is working. If the brain is sort of sluggish and in a low brain function state, that means this signaling can pass through very quickly. The threshold, what's known as the resting membrane potential, and we'll go into that later, is low enough that, okay, the signals keep plowing through, right? And these are nociceptive signaling, which is our pain signaling. Once you've got that premonitory phase finished, phase 2 is the aura phase, and only 1/3 of patients get the auras, which are just sort of visual disturbances, or sort of, they can also be auditory disturbances just before you're about to get the pain of a migraine. So this aura phase is pretty quick in the grand scheme of things, 30 to 50 minutes of sensation, which is what's linked biochemically with a slow nervous system. And the slow neuron depolarization, which just means the neurons are sharing their message from one to the next. This is slow and it happens over 30 minutes, but it's sort of a pathologic way of the nerves of talking. So this means ultimately that there's a whole bunch of electrolyte imbalances that happen in the brain right around the nerve cells. high potassium on the outside of them and high sodium and calcium on the inside of them, which tells the body basically, okay, we've got to ramp up symptoms. Phase 3 is the headache pain phase of the migraine, where this nociceptive pain signaling has moved from the outer parts of the brain into the nervous system and specifically affecting the trigeminal nerve. Okay, so it's moved from the outside to the inside nervous system. Now the trigeminal nerve is activated, and these nerves become overly sensitized, which means that any sort of little change you feel as pain a lot higher than you otherwise would. So if you have had migraines before, you probably know that when you're in a migraine state and you bend over or you cough, suddenly your pain is worse. And that's because these trigeminal nerves are overly sensitized. So thinking about these nerves, again, this neurovascular theory is so important because it has to do with the resting membrane action potential of the nerve cells, which are neurons. This is just, very, very precise science that tells us about, okay, when the nerves are talking to each other, there's an electrical signal that goes up and then it goes down once it's passed through. The resting membrane potential is that line you see on the bottom there that says, okay, we're not just going to talk with any old signal. We're going to have to make sure this is an important signal that we want to share with the next neuron. In migraines, the trigeminal nerve becomes overly sensitized, meaning that resting membrane potential goes up a lot higher. So any old little trigger will cause the nerves to depolarize or talk to each other, and the pain signaling will follow through. So this is new stuff when it comes to thinking about migraines. And the next slide here tells us about the specific receptors that have been discovered in a migraine pathophysiology that lead to the pain and the vasodilation. Okay, so this is something to just keep in your back pocket here. So CGRP, calcitonin gene-related peptide, is what's known as a neuropeptide, so just a signaling molecule for the nervous system that causes a whole bunch of downstream effects. From vasodilation, again, the vascular component of migraines, to neurogenic inflammation, which means inflammation in the nervous system, in the brain, to peripheral sensitization, which just has to do again with that resting membrane potential, gets lifted, so the nerves are super sensitive. That's the role of this neuropeptide, CGRP. So when we talk about different types of migraines, the diagnostic literature says there's just 3 types, okay? One is with aura, one is without aura, and one is known as chronic migraines, where, patients will have pain for over 3 months, more than 15 days of the month, and migraine-like symptoms of at least a quarter of the month. So chronic migraines end up being in this special category of, wow, you're getting migraines all the time. So this tells me naturopathically that resting membrane potential in the trigeminal nerves is just not going back to its regular state. You've probably heard, from friends or family members, oh, well, I get vestibular migraines, and well, I get menstrual migraines, and I get, abdominal migraines. And these are just kind of subcategories within these broader categories. And that just tells us where the symptoms are being the most, are showing up the most, and how the body is most affected. Something that I don't hear about all that often are these kinds of migraines known as letdown migraines, which happen actually quite frequently in my migraine patients, where they have a stressful event and suddenly they are relaxing from their stressful event, whether it's going to sleep or waking up in the morning after a restful night, and that's when their headache happens, right? So thinking back a few slides into the biochemistry, when we talked about the phases of migraines, that first phase involves what's known as, remember, a sympathetic nervous system, a trigger that causes that sympathetic nervous system to activate. So these letdown migraines, it makes so much sense. You have a huge stress, and that's fight or flight mechanism that kind of causes everything to happen and all the nociceptive signaling to continue. So just pretty cool stuff.
We wanted to share what's being talked about in the scientific literature, specifically in regards to different natural treatments. And we're going to talk about that. And then we're going to talk about ways that we kind of strategize with our patients who are suffering from migraines. So we wanted to bring up feverfew because this has been a long time favorite in the naturopathic community. This is a beautiful herb. And what's interesting when we pull the medical science that's documented about feverfew is that we see that, as with many of these herbs, it's not a single action in which feverfew works. So we know that this plant helps as an anti-inflammatory, and it also affects the vascular smooth muscles. So we get this double action from this plant. And this is one that's in a lot of migraine formulas. It's also used as a solo herb that can be used both as a treatment for acute migraines and as a prophylactic option. And it's just so cool to see in the medical literature these herbs now being really well documented for what it is that they do.
The other research we found was on magnesium, and specifically not just on magnesium treatments, but on what was found was that if patients are low in magnesium and have a documented deficiency, they tend to have more migraines. And so this is really interesting. This is a whole new perspective for me in terms of thinking about how to prevent migraines from happening. It's just it's just the medicine is in preventing them. And so magnesium of all different types can help improve lessen the frequency of migraines. But it also supports the vasculature and it regulates vascular tone. So thinking about migraines, again, just being partially vasoconstricting and vasodilating in those cranial arteries, we've got to have some help on board that regulates that vascular tone, those arteries making those changes. And so ultimately, magnesium, like I said, of all different types can help with this. In the literature, I've seen magnesium citrate be quoted, magnesium threonate as well. And then a new type of magnesium that's pretty much only in clinical trials is one known as magnesium pedolate. The threonate is one that's most readily available. It crosses the blood-brain barrier, which is where we want its effect. We want it in the brain.
B2, vitamin B2 or riboflavin, has for many years been documented to have an effect on reducing migraines. This is a really cool study that came out in 2021 that showed that riboflavin is not just helping to reduce the migraine pathogenesis itself, but it actually is helping as an anti-inflammatory and an antioxidant that's protective. It's considered to be neural protective. So when we have these inflammatory events in the brain, we want to mitigate that inflammation to the best of our ability. And we see that B2 can be helpful for this. So B2 is another tool that we have in our clinical toolbox to help with folks who are dealing with migraines.
Another research that we dove into was in regards to what's known as a TENS unit. So this is a topical device that is transcutaneous electronervous stimulation, okay? Topical device both to the forehead to stimulate the trigeminal nerve, but also can be applied to the arm to stimulate the peripheral nerves of the arm. So if you can imagine, why would we want to stimulate the trigeminal nerve? It's already overstimulated in a migraine. So the thought here and what we've seen clinically as well as in the literature is that when you stimulate the nerves with just an ongoing kind of background noise, then the nerve knows, okay, I can reset at this point, right? And so that's what's pretty cool about these transcutaneous devices. Maybe you've seen ads for something known as Cephali. That's sort of the one that gets thrown around the most. But what's so cool about this transcutaneous electrical signaling is it's just a way to desensitize that trigeminal nerve. And the biggest thing they've noticed is this can both be a prophylactic treatment as well as an acute treatment for migraines. So definitely we see a diminished frequency of migraines when we have this device on board as well.
The other really cool research that we uncovered that's out there is in regard to CoQ10. Now, many of you might be taking CoQ10 for cardiovascular reasons or as an antioxidant. So we know that CoQ10 has this really important play within our energy production system for our cells, our mitochondrial energy production. So it was presumed that maybe CoQ10 would help with migraines because it's so effective in helping that recovery of energy for ourselves. We also know it's an anti-inflammatory and helps as an antioxidant. It reduces these reactive oxygen species. But what's really cool is they've uncovered that CoQ10 actually decreases CGRP, which is that vasoactive peptide that we know is so much part of the migraine picture now. So just another really awesome, very available micronutrient for us. We can get this through animal organ meats in our diet or salmon, but we can also get this as a supplement.
So that's just a deep dive into the recent literature. When we think about migraines and the treatments that have been out there, it honestly hasn't been all that long that we've had pharmaceutical treatments for migraines. Prior to 1976, there was nothing available for people who suffered from migraines to take orally. So 1976 were those first vasoconstrictors or ergotamine, and those have really been phased out at this point. Then several decades went by, and then 92 is when the triptans came on board, things like sumatriptan or Zomig even. Those are, again, using the vascular theory of how migraines worked, were vasoconstricting. And those are very frequently prescribed these days as well. Again, take another decade of time, and that's when we start to notice, okay, well, we can do some pharmaceutical work here with the nerves, okay? And that's when we get Botox injections happening, nerve blocks to the special parts in the face and neck that prevent the migraines. Then we see in 2018 some subcutaneous injections with this CGRP antagonist. So that's brand new. I mean, thinking about it again from this phase theory, it wasn't until 2018 that we started to see the evolution of pharmaceuticals to bring on board something that addressed the neuropeptide CGRP. So again, 2018 rolls around, we're doing injections again, and 2019, we've got an oral CGRP antagonist known as Nurtec that comes onto the stage. 2022, just last year, is when we start to get some ongoing clinical trials about other ways to address migraines for some high-dose anti-inflammatories that are non-steroidal, high-dose calcium channel blockers. Again, this would address the nervous portion of the migraines in lieu of the vascular portion.
Now,
So
oh yeah, go ahead.
I was just gonna say we share all this info because even though as naturopaths we're not big prescribers in general, but we share all this info because it's just so helpful to see what is out there, both from a pharmaceutical perspective and also from an herbal perspective. And I'll have Dr. Molly talk to us more about these CGRP antagonists.
Yeah. So as Dr. Rosalie said, of course, we're wanting to really treat the cause with our patient and understand why it is that they're triggering into these migraines and stop this pattern. And we found that it can be very helpful to have some medications on board with certain patients to help them stop that pattern of migraines and as rescue agents. So they're just not suffering in quite a bit of pain. So these tend to be some of our favorites that are used in our clinic. There's both Nurtec and then the brand new nasal medication, which is also a CGRP agonist, that's this Zavspret. And it is, these are both used to stop that acute migraine and also can be used prophylactically with that oral, that Nurtec, where somebody could be taking it every other day to prevent. Now, these both have pretty minimal side effects, which is a game changer for the pharmaceutical market in regards to headaches. We're looking at usually mild digestive upset if there is going to be a side effect from these for patients. So that's pretty game changing for a lot of people, and something that we like to give a nod to, because as naturopaths who do prescribe here in the state of Washington, there is a time and a place for supporting our patients who are in this type of really intense pain with the migraines. So of course, you are all here though to hear about more preventative and natural holistic ways to support the body against these migraines. As natural and holistic providers, we're trying to first and foremost really identify and manage the triggers. Now, here on this slide, we say all the triggers, because what we find is when that resting potential, that action potential goes up for the membrane there for the communication of those nerves, they can be hair triggered. It could be something really minor. It could be a thought of something stressful, or it could be a loud noise or a noxious smell, or, really bright lights. So many different triggers for different folks that will stimulate those nerves into sending these signals inappropriately. So we know from, what's documented out there, as well as what we see quite frequently with patients, that things like alcohol and sugar and environmental toxins can all make this happen. We have some patients where it's weather shifts, the barometric pressure changes, and that tends to trigger their nervous system. So it's important for us to think about what it is that's going on with each person as an individual. And as you're sitting here listening to this talk, think about, yourself, if you're the migraine sufferer, or your family member or friend, what it is that might be out of balance for them that could be triggering these events. And that's really helpful in treating the actual cause and getting to the root of making a difference long term for these migraine patterns. We also put on here sinusitis, which is, can be an infection or an inflammation of this upper tissue and this upper palate area. And then also SIBO, which is that small intestinal bowel overgrowth. So both are what we would consider dysbiotic flora changes. So we don't like it when we have a disrupted balance in our microbiome, and they can actually influence our nervous system here. So we want to be thinking with our patients about stress management techniques, of course, reducing these triggers, calming down that resting potential is the name of the game. So calming it down so you're not hair triggered anytime you have a stressor. And then also we know that some diets tend to lend themselves towards this. So the low tyramine and the low histamine diet can be also helpful as well for many patients. We like to have some what we call abortive therapies on hand to help people push them out of that acute, intense migraine pain. So we know that ginger can be an option there for some patients. Ginger tincture. There's also great evidence, and we've have clinical use of migraine IV drips as well to pull patients out of an acute migraine, and that happens within minutes of getting that drip. So it can be a huge relief when somebody is just suffering. And then there's another treatment we're going to talk here in a second about called the sphenoganglion nerve block. And that is also something that can be used to pull people out of acute migraines. Now, as holistic natural practitioners, we have different tools in our testing toolkit. We love to, of course, see our basic annual labs for our patients. So remember, if you're suffering from migraines and you haven't gotten your basic lab work done, make sure to get that done. A lot of people have fallen through the cracks with the changes that have happened over the pandemic for folks. So make sure you're getting in for your annual blood work, because sometimes those can give clues and help people with rebalancing things. But as far as specialty tests that are kind of more unique to the functional medical providers and the naturopathic doctors, we're really looking at things like our food sensitivity testing being helpful, because these also become triggering inflammatory events. A person may eat a food, say it's eggs, for example, with this person's test. You see they are scoring very high for eggs. Maybe they eat the eggs, and then boom, sometime within that next 72 hours, they may have a migraine event. So, and that gets really hard to pin down, because it's like, oh, but I had the eggs yesterday. Why am I having the migraine today? So that's where these blood tests can be really helpful. So we have different panels that we use for that, with blood tests to check out food sensitivities, because food is something that most people can control in regards to triggers where it's hard to control the weather pattern changes outside, for example. But if we can get that inflammation to come down in general, we have less of that reactivity. We also, for some people, are doing PCR stool analysis or PCR testing and even culture testing of different areas of their microbiome, whether it's their gut or their sinus area. We may be looking at SIBO breath testing if we're concerned about the gut being involved, because we've seen so many of our SIBO patients who are suffering from migraines chronically. And then also we like to look at magnesium stores, because as Dr. Rosalie was talking about, magnesium is so important both prophylactically as well as for in regards to treatment with our migraines. We should also mention with that hormones being really important. So if you have hormone induced migraines, because different hormone fluctuations can be a triggering response for those nerves, then we always like to look at those hormone panels too. When we're thinking about the body's defense system, we always like to think about not just diet and supplements and herbs, but we also want to think about what's going on with that microbiome, with the gut health being the majority of where those microbes are, and then what we're doing day to day with our lifestyle. So making sure that we have that adequate sleep, that adequate hydration, those are all very important. And we have to, take a moment to mention those as natural providers. So we have a lot of nutraceuticals and supplements at our disposal here in our natural apothecary. We have both an online store, which you can go onto our website and access. There are 3 different portals for online stores for patients, as well as an in-person apothecary in which you can access things. So Dr. Rosalie is going to talk about some of our favorite tools.
Thanks so much, Dr. Molly. So one of the heavy hitters here that combines a lot of the herbs that we talked about earlier is Migranol. which contains that vitamin B2, riboflavin, as well as magnesium, feverfew, and then it adds in some additional help, which is rosemary, so nice circulation tonic there, as well as curcumin, which diminishes inflammation. So Migrainol is one of my first line nutraceuticals for helping folks with migraines from a preventive perspective. Also on board here is their CoQ10. Between 100 and 200 milligrams is how I dose it for specifically that CGRP, preventing the CGRP neuropeptide. Curcumin extracts, there's all sorts of different turmeric products out there. And what's important with turmeric is that it actually has the a therapeutic amount of the curcumin extracted from it. So curcumin has the best data on being the most anti-inflammatory constituent in the bigger herb, which is turmeric. So with my curcumin extracts, I want to make sure that they're well absorbed as well. Which is why I end up looking at the curcumin phytosome product. So they've sort of enveloped the curcumin itself in a lipid or a fat, so it's better absorbed by the body. We also have a product known as Neuromag, which has that magnesium threonate in it, which is kind of new in the supplement world. We weren't able to get that not that long ago. So Neuromag has the magnesium type that crosses the blood-brain barrier. And then lastly, our basic B complex, which contains vitamin B2, riboflavin, as well as other B vitamins that help specifically with preventing migraines from the frequency perspective. We also have some botanical medicine at Prosper. So this is a combination of different kinds of herbs. Ginger tincture is one that I go for because it's really helpful to just have it in your purse or your backpack or in your car, because sometimes you don't know when the migraine is going to hit. And I'll have folks dose ginger tincture, sometimes 2 or 3 dropperfuls every 30 minutes as they sense their migraine coming on, to kind of help abort it. In the materia medica, ginger is known as a migraine abortificant. So it uses that word very precisely for, okay, we're going to stop the migraine. We also have feverfew capsules. Our Vitanica brand is very clean herbal medicine that sort of extracts from the feverfew and the butterbur. It combines those two herbs together with an herbal extract that has the kind of concerning pieces removed from it. You'll see on this image here, it says PA free formula. That's because it's removed the pyrrolinyl alkaloids, which are difficult for the liver to metabolize, especially when taken long term. I also use some homeopathy for migraines, and specifically these 3. There's more homeopathy out there for migraines in specific. Ignatia is the one that I use for my migraine folks who are really sensitive. So it's just, whether it's physical sensitivity or sensitive to smells or just emotionally sensitive, that's where Ignatia comes in really handy. Natmur is another one that I use for right-sided migraines that come on pretty precisely, like it's after your menstrual cycle, or it's just it's there. It's just like it's it's pretty, the migraine makes itself announced very, very quickly. So, for example, part of this homeopathic remedy is the headache feels like 1,000 little hammers knocking on the brain. So that's what I think of when I prescribe Nat Mura to folks. And then lastly, silica is the one I use for my patients who are overexerted, whether it's physically they're training a whole bunch for, some sort of competition, or they're emotionally overexerted. It's just pretty high stress and overwhelm. And the other piece with this silica homeopathy is that the migraines are made better when they lie down. And cover their head. So that's the homeopathy that we can use for migraines.
The other kind of unique approach that we use here as holistic providers is we will do a procedure with our patients called the sphenocath procedure. Now, this may be something that you've heard about, or it may be totally new to you guys. This is a procedure where lidocaine is put into this area called over the sphenopalatine ganglion area. Now, this is a nerve bundle. And what's really interesting about this nerve bundle that's located right behind the nose, is that it contains bundles of nerves that communicate to the autonomic nervous system, the motor nervous system, and the sensory nervous system. So it's a huge kind of mastermind little area back there. And what has been found is that if the resting membrane potential can be lowered for that nerve bundle, then it can help as a rescue remedy for people in acute migraines, and it can reduce the propensity to have chronic migraines. So what happens is we'll have the patient recline, and we'll go in and we'll put in a little bit of lidocaine up into the nares so that it's comfortable, and then we'll apply this catheter. And remember, a catheter is just kind of a name for a long tube that can deliver some substance. So we put lidocaine into this catheter, and then we can help inject into that area the lidocaine, and then we have the patients hold at a very specific angle for 10 minutes. And we'll know if we've got that lidocaine to numb out to appropriately be on that sphenopalatine ganglion nerve bundle, because we'll get a change in the temperature on the patient's cheeks. So we use these little temperature stickers that almost looks like something you'd see on a fish tank. And so we watch the temperature rise on their cheeks, and then the patients will tear on that side too. So it's done on both sides typically. And my patients will come in and we'll always ask them kind of on the 10 scale, 1 being or 0 being no pain, 10 being really high, where they are for their migraine pain that day. And then we'll ask them about photophobia as well. Like, is the light too bright? Is it hurting your eyes? How is the glare today? And they give us these numbers. And so it's pretty amazing having people sit up after this little 10 to 15 minute procedure, and for pain to drastically decrease. People who walked in maybe with needing, glasses on to reduce the glare, like sunglasses on, can have those come off, and their pain is much reduced. Now, the theory about why this works, though, is that by using that lidocaine, you're helping to reset that resting membrane nerve potential. So it's not so easily hair triggered. So one of the reasons why this was such a cool responsive therapy that we decided to integrate into our practice is that the majority of patients who are doing this procedure, and you'll see this in this medical literature write-up, have relief within 15 minutes at the rate of 70%. And then after 2 hours, that goes up to almost 80%, which is pretty cool. So, and at least 50% of them had a drastic reduction of headache intensity. So it's pretty low risk. You do have some numbness that drips down into your throat, but a slight bit of discomfort with that for some people, but it doesn't interrupt your ability to swallow or breathe. So it's very, very safe. And that numbness does wear off after a few hours, and typically after somebody has a reset of sleeping. That also helps with the nerve potential also being calmed down as well. So this is just kind of those numbers put into a graph form, so you can see quite a bit of relief from the freedom of that headache pretty quickly. And you can see how quickly, just in a matter of minutes, people will respond to having that that relief from that intranasal delivery of the lidocaine. So kind of neat. And we also see that on average, if somebody is going through this procedure, by the third procedure, they're having drastic reduction in their chronic headache pattern too, with their, I shouldn't say headache, but their chronic migraine pattern as well. So it's a pretty neat little tool that we can add on to some of these other options that we're doing with folks.
So we've talked a lot about, cool therapies that and supplements and prescriptions that can really help with migraines. But at the end of the day, it's not so much like one thing will heal the migraines, right? This is very much a multi-system approach. So, part of naturopathic medicine in general is just to optimize the foundations of health, to make the body able to heal itself better. So this is very much true when it comes to migraines too. It's just figuring out what are the triggers. Is it bodily triggers? Is it mental triggers? Is it, you name it. So optimizing the foundations of health is huge. So making sure you're well hydrated is especially important for our migraine folks. Optimal sleep, also very important. Stress management. How do you de-stress from your daily life? What you hear on the news, what you're experiencing in your home. You name it, right? Stress management is key to prevent that fight or flight expression that leads to the pain of a migraine. Exercise, right? To make sure ultimately that the arteries are being exercised so that they don't get sluggish in their expression and their vasodilation and vasoconstriction. Nutrition is huge too, making sure it's an anti-inflammatory diet that isn't high in simple carbs, and that has a lot of healthy fats. I have had some clinical experience with a pretty high fat diet being helpful for migraine folks as well. And again, this kind of comes from the antihistamine and low tyramine perspective that we talked about earlier. Hormone balancing is huge. So what we do see with migraines is that they are commonly, they're pretty common during our fertile years of life, for those who do get migraines, and then they start to taper off with menopause. So hormone balancing from the cortisol perspective or the melatonin perspective or the sex hormone perspective is really important as well. Antioxidants, this comes back during every doc talk here. How do we diminish inflammation load? It's an ongoing treatment. And then there's alternative approaches, from acupuncture to Ayurvedic medicine to counseling, right? How do you detox from, the mental, the mental difficulties, the stress ultimately. Counseling can be huge for that. Herbal medicine, it could be helpful on board. Homeopathics, injectables, whether it's a magnesium drip or just kind of like weekly other intramuscular injections. And then our nutraceuticals supplements come on board. I also notice getting some body work in a treatment plan becomes really, really key especially when we're trying a whole bunch of things for migraines and we're not seeing it budge. So I've seen craniosacral come back as a really, really, really beneficial kind of hands-on tool as well.
We want to invite you all to our next Doc Talk. It's going to be on alcohol and its roles in chronic illness. We're going to be doing a nice review of the information out there about alcohol. And it's going to be on that second Thursday in November. So please join us for that. You should see us sign up on our website as well as emailed out to those who are on our mailing list. And of course, if you are dealing with chronic migraines and want support with this and are really looking for an individualized treatment plan, that's what we do. We love to help people in that regard. So please check us out online or give us a call and we'll get you set up for an appointment to go over what's going on for you.